Welcome to the Healthcare Plus podcast, hosted by Quint Studer and Dan Collard. I'm Nicole Webb-Bodie, partner at Healthcare Plus Solutions Group. Thank you for joining us as we bring together leaders and change makers from across the healthcare industry. In each high-impact segment, you'll hear about the latest challenges organizations are facing and learn how guests are rewiring solutions to drive real change. Plus, you'll walk away from each episode with practical tools, techniques, and best practices to implement in your own role and in your organization. For more information on your host or to listen to recent episodes of the podcast, please visit www.healthcareplussg.com/podcast. Now, I'm pleased to welcome today's host, Dan Collard, who will introduce you to our next guest.
Well, hi, everybody. It's Dan Collard, and this is another episode in our series of podcasts talking about a very special conference we have coming up in April in Atlanta. Today, I'm joined by one of our HPSG family members, a longtime friend and colleague of over 14 years, Lisa Reich. Lisa, welcome to the podcast.
Thanks so much, Dan. Great to be here.
14 years we've been doing this together. Can you imagine?
It's fast. Time flies.
For our audience, why don't you tell them a little bit about yourself, the kind of coaching you've done, your background professionally. Let's let our audience meet Lisa Reich.
Sure. I'm a nurse by background, as was my mother, as is my sister. So I come from a family of healthcare providers of sorts. And I have been a nurse almost 40 years now. So I was the nurse with the white cap and the black stripe on it that wore whites, and kind of do miss those days a bit. I've been in coaching now for about 15 years, I guess, getting close to that. Really just love to be able to impact organizations, be able to see what they're doing, be out in the field, watching care be delivered in a variety of settings, whether it be a large academic hospital or a very small critical access hospital, some of which you find some of the best practices that are living, breathing in the hallways and in every patient interaction that exists.
Yeah. And you know, one thing that I've always admired about you, when you talk about coaching in different settings, that really is a literal reference there, because you've spent time in hospitals, you've spent time in clinics, and you've also done some very special work in organizations that help with substance abuse, addiction treatment, et cetera. Why don't you talk a little bit about that?
Have. And you know what I really find, I'm going to say interesting, is that a lot of the things that we've coached over the years, and maybe even I've rewired a bit, really do work in all types of settings where care is delivered, whether it be in an ambulatory surgery setting or a clinic setting, or as you said, like in a substance use disorder setting or mental health settings. All of those are where still caring and compassionate people are trying to make people better. And it's great to see that some of what we've taught over the years really does transcend into other areas, not just acute care, but into other areas of healthcare.
Yeah. Well, a couple years ago when we began thinking about writing this book, Rewiring Excellence, you were one of our HPSG family members that we reached out to and said, let's talk about how rewire really resonates. What does rewire mean? And you had a whole section in our book specifically about rounding on patients. Why don't you give our listeners a little bit of the Lisa Reich version of why is it important to rewire? Why is now the right time to rewire? What has the whole framework of rewiring meant for you in your coaching practice?
Rewiring is really an interesting way to look at it. And I think that's what has just appealed to me when we started and wrote that book, was there were pieces that we had been coaching for years that just simply didn't work anymore. And it was almost surprising when you paused and said, okay, what is the outcome of this? What are we really trying to achieve by doing X, Y, or Z? And we look at it and go, it's not moving it. And for a long time, we just kept doing the same thing and hoping it would just change. But now we've really paused to say, if we're not getting the outcome, maybe we need to look at what we're doing and rewire it. Not completely throw it out or completely change it, but maybe it's what I call little tweaks that we do to it. And like with the patient rounding part, it wasn't that we stopped patient rounding, but maybe that we look at the approach that we're taking with it, that we use some different keywords that maybe people can identify with and help define what we're trying to have our patients see in the care that we're delivering. And not dig in the dirt, because that was a big part of it. Is I found when I did patient rounding years ago, I was looking for problems, and that's how we did it. Now, it wasn't wrong. It's just what we did, but did it achieve the outcome that we wanted? Back then, maybe, because we were at least talking to patients, which we hadn't been before. But now patients have gotten much more savvy at what they're looking at and how they're looking at it. So we have to get better at describing it. So it's just a slight rewire to get a better outcome.
And that's the exact theme that we're inviting folks to come join us for April 28th and 29th in Atlanta at the Atlanta Gateway Marriott. Rewiring Healthcare, Foundation to Future, the name of our conference. And I am just tickled to death that we're going to have you up on the main stage imparting some of that wisdom. And as one would guess from a nurse's heart, a theme of what you're going to call caring connections. Why don't we give our audience a little bit of a sneak preview, if you will, from what they'll hear from your part of the conference?
Sure. I for a long time have coached that compassion and empathy and kindness are all really wonderful words. As a matter of fact, when you have them on a PowerPoint, they look fantastic. But nobody ever actually accuses people of being those things until they do something that demonstrates that. And trust me, I've read literally hundreds of books on those three things in particular, empathy, compassion, and kindness. Read and watched, and you know, Dan, you've watched as many people as I had, probably even more, where we've observed. And sometimes you can see it when somebody interacts with another, whether it be a leader with a colleague or a nurse or a food service person with a patient. Just watching those interactions, you just can see that sometimes it just connects differently than maybe other times. And I really tried to narrow it down to what are the specific human connection points that are made when you can kind of feel it in your heart. When they deliver it, that it actually like sends shivers through you because you can just feel that compassion and that empathy and that kindness come through. And maybe what's missing when we don't. And that's really what I'm going to cover is go through some of those really key message makers that we have with our human connection points that we do as human beings. The days of technology, we know technology gives us huge advancements. We're seeing even more of those now, and probably over the last decade or so, they've really rapidly produced technology. But there's still that human element that makes the difference. That's the one that makes the moments memorable for not only patients, but for each other. And that's really what I want to get to in my section that I'm going to do at our conference that I'm really excited about.
Well, what I like about your message is even though you sort of begin with that nurse's heart, we know that this is a message for everyone in the room. We do great work with our friends over at Aramark Healthcare Plus, where we have folks delivering food, we have folks cleaning the rooms, et cetera. Folks that don't have clinical initials on their name badge, but they're ever more part of that care team. And so I'm excited about your message because it's not just a nurse exclusive message, is it?
Not at all. And you know, there's some of the greatest use of that empathy and compassion I've seen with our people in going to be the housekeeper or our environmental services techs as they go in and they can make connections with those patients at times that just are so heartwarming. The patients actually feel like they can ask them questions because they're not going to be thought of as a dumb question or minimized because of the question. And so they feel really comfortable having that conversation with maybe somebody that isn't wearing a clinical hat per se, but certainly as a caregiver in every sense of the word.
Well, if you're an organization out there that's part of our audience looking to take the whole world of caring connections up to the next level, this specifically is a session from our good friend and colleague Lisa Reich that you won't want to miss. April 28th and 29th, Atlanta Gateway Marriott, Rewiring Healthcare, Foundation to Future. Lisa, I'm so excited to have you as part of the event. I know it's going to be great.
and I can't wait to see everybody that attends.
If you would like free resources and access to our latest books, articles, and industry insights, visit our website at healthcareplussg.com. We hope you'll join us next time as we continue our journey to make healthcare better for caregivers, patients, and communities.